If you learned English from textbooks, exams, and direct translation, some phrases sound correct, but native-speaking nurses don't use them. In this video, I'll show you the natural, professional way nurses speak in real hospitals, including pain, medications, symptoms, patient communication, and documentation language. Let's get started. Don't say, "Why are you in pain?" Say, "Can you tell me how the pain started?" Or, "What were you doing when it began?" Why questions feel judgmental. How and what questions get better answers. Don't say, "The patient says pain is big." Say, "Patient reports pain 7 out of 10. Don't say, "When do you feel pain?" Say, "Is it constant or does it come and go?" Does anything make it better or worse? Don't say, "Do you want to vomit?" Say, "Are you feeling nauseous?" or "Any nausea?" Don't say, "Do you have a breathing problem?" Say, "Are you feeling any shortness of breath?" Or, "Do you feel like it's hard to breathe?" Don't say, "The patient feels bad." Say, "The patient reports general malaise." Don't say, "What drugs do you use?" Say, "What medications do you take?" Or, "Are you taking anything at home?" Because the word drugs can be ambiguous. Patients might think illegal drugs or something they're being judged for. So when you ask, "What drugs do you use?" the patients might feel uncomfortable, leave out important information, or misunderstand what you're asking. When you say medications, it's clear, professional, and natural. And it opens the door to prescriptions, supplements, over-the-counter medications, and herbal medications. Clear language gets safer answers. Also, some patients don't consider supplements or vitamins to be medications, so sometimes it helps to ask about these directly. Don't say, "You can take this if you want." Say, "You can take this as needed." Don't say, "This medication can cause problems." Say, "Let me know if you feel nauseous or sleepy." Or, "This medication can cause dizziness." Clear, specific, calm language builds trust. Don't say, "Can I check your blood pressure now?" Say, "I'm going to check your blood pressure." Why? Because in healthcare, this isn't a casual question. This is a routine part of care. When you say, "Can I?" you're asking permission in a way that implies the patient can easily say no. And if they do, then you have another problem to solve and on a tight schedule. Saying, "I'm going to check your blood pressure" is clear, calm, professional, and direct. It sets expectation, not pressure. You're not removing consent. The patient can still say no, but you're leading the interaction rather than negotiating. This phrasing sounds more confident, reduces confusion, and keeps care moving efficiently. This is why doctors and nurses are taught to say it this way. If you want it slightly softer, which is great for nervous patients, you can add a little buffer. Say, "I'm just going to check your blood pressure." Or, "I'm going to check your blood pressure now, okay?" This keeps authority and rapport. Don't say, "Blood pressure 120 over 80. Say, "Blood pressure 120 over 80. Because in healthcare, blood pressure is read the same way it's spoken between professionals. It's faster, clearer, and easily understood. It's the standard phrasing nurses and doctors actually use. Don't say, "Do you understand?" or "Do you have any questions?" Say, "What questions do you have?" Because "Do you understand?" puts pressure on the patient to say yes, even if they don't. And "Do you have any questions?" is a yes or no question. And many patients will say no, even if they are confused, embarrassed, or overwhelmed. When you say, "What questions do you have?" you're doing 3 things. Making questions expected, not optional. You're keeping it open-ended. And you're creating a safe space for the patient to open up. It shifts responsibility from the patient to you, which improves communication and safety. This is why this phrasing is taught in healthcare. Now for you, what questions do you have? Let me know in the comments what you struggle most with in medical English. And if you'd like to dive deeper, I've linked my Fluent Nurse course in the description.